Standards help guide us in understanding not only what we should do, also why. When we explore the AACN essentials, there's a lot of behaviors outlining what our practices should be. However, there's also an element of why. Why is it that we should work collaboratively to ensure that not only that we are aligning our content and our courses with evidence-based practices, also making sure that we're working collaboratively to achieve a common goal. Welcome back, everybody, to Dr. Sellars Educate. We're happy that you're back. If you haven't already, make sure you go ahead and print out the actual study worksheet that's listed right here in the description. This is going to help guide you through our conversation today as we explore and really talk about a best practice related to alignment of our curriculum and the decisions that we make about content that we integrate into our course. Designing a course is a lot of hard work, and we want to be able to design our courses, our entire curriculum, in a way that's going to ensure that we're achieving our programmatic outcomes. One big programmatic outcome in nursing programs is having a high NCLEX pass rate. That is the summative evaluation and validating whether or not our students have truly comprehended the concepts, the minimum concepts that they need to in order to make safe patient care decisions when they are practicing independently. All right, and then the next resource we want to make sure that you take advantage of, some of you may realize it's available, others maybe not, is going to the actual website for the essentials. Okay, so if you go to aacnnursing.org/essentials, you will see the option to download a free copy, or if you want a printed copy. I'm a paper type of person, so I actually have both. It comes in a very nice booklet that's shipped to you. What I also want to emphasize is even if you're not CCNE accredited, if you are a pre-licensure program, which we know that is the exam, the alignment with the CNE exam, all the CNE exams really is from a pre-licensure standpoint. It doesn't mean that you're not going to be successful if you are a graduate or post-licensure faculty member. It just means that some of the concepts may not be as commonly practiced in your everyday teaching strategies. One good example is going to be exam analysis. Oftentimes at the graduate level, we don't give a lot of exams. There are some, especially in our nurse practitioner programs, in our CRNA programs. However, in our traditional MSN programs in nursing education, as an example, in leadership, there are very few, if any, exams. So perhaps we're not as competent in exploring exam analysis in order for us to make decisions if we have developed a valid and reliable exam. That's okay. It just means that you're going to spend a little bit more time making sure you have the deep comprehension of concepts that we know is essential in order to achieve that passing score on the CNE exam. All right, so let's go ahead and go to our presentation that we're going to explore today. We use Canva, so that's Canvas, no S, to develop our content. And the reason why we really like Canva is because it is web-based. So what that means is you don't have to worry about digging through emails to or through your different laptops. If you have a work laptop, you have a laptop you use at home. Canva is just a great platform, web-based platform to develop your presentations. It's also very engaging. You can easily embed videos and other engaging activities to make it easy for you as an educator. That's what it's all about, being smart, right? Working smarter, not harder. So let's talk a little bit about what these core competencies are. We're just going to hone in on one for our time together today. We want to make sure that our core competencies related to the behaviors that we're expecting our students to demonstrate is aligned with the actual AACN essentials for improved outcomes. In order for that to happen, we want to make sure there's integration of those competencies into our content, into our assignment. So what does that look like? Well, first and foremost, we want to make sure there's strong alignment between the content that we're teaching in our course with the learning objectives or the learning outcomes, right? We're going to go to the textbook. If we're teaching on the cardiac system, we're going to physically go to the textbook and make sure that that content is accurate, right? We want to make sure it's aligned with the conversation. That's all a presentation is. It's a conversation that we're having with our students about the cardiac system. If there's misalignment, if there's information in the textbook that's not accurate or the opposite, if there's information in the presentation that's not accurate, it's going to cause confusion for our students. If there is not alignment with the textbook and what we're teaching in the classroom with the actual clinical experiences and healthcare agencies' policies, that's going to create a disconnect, right? Confusion for our students. So we want to make sure that we are preparing our students in a way that's going to help them achieve success. That's exactly what the essentials are all about. We're enhancing our curriculum based on the essentials to ensure our nursing students are well prepared for evolving healthcare environments. And we know that there's always changes that are occurring in healthcare, and we want our students to be ready so they can make safe patient care decisions. Our ability to develop these competencies and to ensure they're aligned and integrated into our curriculum really does support the needs of our community. This is helping our students make those safe patient care decisions. Patients in our community are going to be more satisfied with their care. Our healthcare partners are going to be happy with us because they are having to do very minimum amount of work to bridge that theory practice gap when our students come work for them. The other component we want to consider is clinical judgment. We want our students to know exactly what patient care practice decisions they should make, and we want them to understand the why. All right, so let's take a look at our thought-provoking question related to exactly that. A 65-year-old male patient with a history of diabetes and hypertension is admitted to the medical surgical unit with complaints of chest pain and shortness of breath. As a nurse educator, you are supervising a student nurse who is caring for this patient. How does the nurse educator's nursing experience contribute to the development of clinical judgment in the student nurse? When you get to the CNE exam, we want you to, first of all, I'm just going to stop sharing the screen for a second. We want you to think about, what is this question truly asking me? Okay. And then, second of all, what is it that you know for sure about content included in this question? When you look at the CNE blueprint that is available on the NLN website inside of the candidate handbook for each of the CNE exams, you're going to see there are behaviors that are part of the description, part of that detail underneath each competency. Our ability to truly engage and demonstrate in these behaviors is what helps students have stronger clinical judgment skills. Okay, I'm going to say that again. Our ability to demonstrate, to adopt, to integrate, to apply these evidence-based teaching practices in our everyday work, this is what helps our students develop clinical judgment. We don't want our students only engaging in passive learning. When we're having a conversation, because that's what, again, a presentation is, we're facilitating the learning, we're coaching students in the classroom so that they have this deep comprehension of concepts that we need for them to have, so that will translate into safe patient care decisions. We got to get them involved in the conversation. We have to engage them in think, pair, share activities, as an example, where they're learning from each other, where they're talking with each other in the classroom so that they can develop these team building skills that we know are essential in the clinical setting. So, yes, when our students complain about group work, we need to have a conversation, be prepared to have a conversation to talk about why group work is so important, or even better, let's talk about it even before our students voice their concerns. Okay, so that's what you want to think about. How can we best prepare our students to make those safe patient care decisions? And this is what the AACN Essentials, as well as the NLN Nurse Educator Competencies, are all about. So let's take a look at our choices. What we're going to do is we're going to unfold each of these answers, okay? And then we're going to go back and look at the question again while you think about the correct option. So A, describe the steps the nurse educator should take to guide the student nurse in assessing and managing the patient's condition, highlighting the importance of nurse experience in clinical decision making. B, compare and contrast the approaches of the nurse educator and the student nurse in assessing and managing the patient's condition, emphasizing the role of nursing experience in shaping clinical judgment. Or C, explain the theoretical concepts of clinical judgment and nursing experience, illustrating their application relevant to the patient scenario, and discuss how the nurse educator can effectively transmit this knowledge to the student nurse. All right, I know that there's a lot of content in each of these responses. So if you want to pause here and come back, you absolutely can. So our objective for our conversation today is really about demonstrating alignment, right? To no surprise. So we're going to talk about the essentials, and then we will end our time together today, specifically focusing on competency or domain six, I should say, interprofessional partnerships. This specific domain talks about the importance of intentional collaboration across professions and with members, patients, families, communities, and other stakeholders to optimize care, enhance the healthcare experience, and strengthen outcomes. When you dig deeper and looking at our entry level versus our advanced level nursing education, you can see that there are higher levels of expectations related to the advanced level of our nursing students, right? So we're talking about post licensure. So you're going to see evaluate effectiveness of interprofessional communication tools and techniques to support and improve the efficacy of team based interaction as opposed to our entry level or pre-licensure. We just want them to communicate, right? Communication is so important when it comes to developing those interprofessional relationships. We talked earlier about these really including behaviors, right? We want to engage in these evidence-based practices and integrate them into our curriculum that allows students to truly understand what communication about our role as a nurse and responsibilities, how does that really look? How does a student go about communicating that in a manner that facilitates a partnership approach to quality care delivery? That's what it's all about. We have to communicate. One example would be a student, first of all, for safety reasons, knocking on the patient's door before they go in, introducing themselves. Say, I'm your nurse that will be taking care of you today. I'm going to make sure you receive your medications. I'm going to make sure I listen to your heart and lung sounds and your abdominal sounds. I notice you haven't had a bowel movement in 3 days, right? So, really being clear about our role is, and more importantly, the impact we're going to have on that patient's care for that specific day. Okay, so that's just one example of how we can truly role model, talk through some specific examples with our students so they truly understand what interprofessional collaboration looks like. Now, I want you to think about an independent activity. Obviously, if we were all live, we would do this together. However, I still want you to consider taking advantage of this independent activity as part of your time that you're committing to showing up today. And hopefully, you've done that by now. On that study worksheet, you've written down your objective. What is that number one takeaway? Just one that you wanted to walk away with at the end of our time together today. We hope you wrote that down on your study worksheet. If not, now is still a good time. The objective is that you're going to truly be able to engage in meeting that learning objective we talked about earlier through curriculum mapping. So you're going to work in a small group, or you may work independently by yourself. You're going to design a curriculum activity or assessment strategy for one of the AACN essentials that ensures it aligns with evolving healthcare needs and prepares students for future nursing practice. You could do a breakout room, you could add a group presentation, and remember, for our graduate level students, this is an excellent assignment for them. All right, that's going to end our time together today. We want you to take some time to reflect on what is it that we talked about. We know that those quality, safety, education, alignment, and practices are essential to ensure that our students are equipped with the information they need to make safe patient care decisions. We talked about our AACN essentials, and we know NLN also has outlined our nurse educator competencies. As you're moving forward on your journey, we also want you to think about the 70-20-10 approach to learning. Okay, so what does that mean? There's a component that we're responsible for to help us truly engage in Malcolm Knowles' philosophy around adult learning principles. 70% is going to be those hands-on experiences. 20% is the feedback we get from others, right? Through mentoring, through coaching, through blogs, through YouTube videos, right? There's a certain standard that's going to be placed on our practice decisions, and there's feedback we're going to get all the time about whether or not our approach and our practices align with the evidence. And then that 10% is an interactive activity, like this one is an example, but a workshop, a webinar. It's going to engage us and truly connect us with the evidence-based practices, right? So you have to think about the structured learning as the foundation. We learn from others, we get feedback, and then we also learn from our experiences. So engaging in that 70-20-30 approach, 70-20-10 approach. All right, so if you chose A, you are correct. So round of applause describes the steps the nurse educator should take to guide the student nurse in assessing and managing the patient's condition, highlighting the importance of nursing experience and clinical decision making, right? So you think about what the question was really asking you, which is about how can I, as a nurse educator, truly advance the student's clinical judgment skills? A is going to be the best answer. B, compare and contrast. That's really not related. Explain the theoretical concepts again. We want to focus on application and integration. That is what clinical judgment is all about. We hope that this snapshot has been helpful. If you have any questions, make sure you let us know. info@DrSellarseducate.com. Our next CNE in 60 days is coming up soon, and we hope that you will join us on the journey. The only way you want to achieve success on the CNE exam is if you quit. CNE in 60 days allows you to have everything you need to ensure that you have closed all your knowledge gaps, and it gives you a clear path to success. We look forward to seeing you in the next snapshot. Have a great day, everybody. Take care.